Have you ever really stopped to think what it actually takes to succeed, really thrive, in a medical field where, well, every single decision isn't just important, it's potentially life-sustaining?
It's a good question. We talk a lot about nurses, and rightly so, but some roles demand this uh, incredible level of specialized focus. It can seem almost superhuman from the outside.
Yeah, the layers of care, the sheer mental effort and precision needed, it often goes unseen until you really peel back the curtain a bit.
Exactly.
And that's pretty much our mission today.
Welcome to the deep dive. We're jumping into the fascinating and, yeah, pretty complex world of nephrology nursing. Our goal here is to give you, our listener, kind of an inside track on the unique skills, the deep knowledge, and frankly, the mindset that's absolutely essential for this role. Think of it like a shortcut to understanding what makes these nurses tick.
And to guide us, we're looking at a really focused resource from Kaplan. It's called 6 Nephrology Nurse Interview Questions.
Right. And it's great because it's not just about interviews. It really opens a window onto the core things employers look for. The ideal answers show if someone's truly ready and has that expertise.
So why should you care about this? Well, maybe you're just curious about specialized healthcare, or perhaps you're in nursing school thinking about a path.
Or maybe you just want to grasp the sheer level of expertise involved in patient care these days.
Exactly. This deep dive should give you some of those aha moments. We're going to unpack these key questions to reveal the core skills and the dedication that really define a top-notch nephrology nurse. We'll highlight what's most crucial in supporting patients with kidney conditions. Ready?
Let's do it. What I find interesting is how these questions go beyond just, technical stuff. They paint a picture of the whole professional.
How so?
Well, someone who's good at problem solving, always learning, and has that really important human touch as well.
Okay, let's start right at the foundation then. When you say nephrology, kidneys immediately come to mind, right? So it makes total sense that the first big question often asked is, can you explain your experience working with patients with chronic kidney disease?
Yeah, and this isn't just a warm-up question. It's fundamental. Chronic kidney disease, CKD, it's the absolute core of nephrology. It affects millions.
So a good answer needs to show real hands-on experience.
Comprehensive experience, definitely. And a deep understanding of these patients. The Kaplan Guide actually emphasizes having several years of experience across different settings like inpatient and outpatient clinics.
Okay, so not just a quick rotation. They need to show they've stuck with it, seen the disease progress in different environments.
Precisely. From, early stages right through to end-stage disease. It shows commitment and breadth of exposure.
So it's not just knowing the textbook definition of CKD. They need to have lived it, basically seen it unfold in real patients. What about the specific day-to-day stuff they need to handle?
Right. So beyond standard nursing, they need real skill in monitoring and adjusting their fluid and medication regimen. This is super delicate work.
Why is it so delicate?
Well, with kidney patients, even tiny imbalances in fluid or electrolytes can cause serious problems very quickly, like fluid in the lungs or dangerous heart rhythm changes. So that monitoring has to be constant.
Wow, okay.
And just as important is educating them on how to manage their condition at home.
Yeah.
Empowering patients for self-care is huge in chronic illness. And then there's the procedural side, too, like performing procedures such as dialysis and kidney biopsies.
Kidney biopsies, that sounds pretty involved.
It is. It involves taking a tiny piece of kidney tissue to diagnose or assess disease severity. The nurse plays a vital role before, during, and especially after that procedure, monitoring the patient.
That really drives home the sheer scope of their responsibility, doesn't it? It's not just general nursing tasks.
Not at all.
It's this highly specialized understanding needed for a long-term complex condition. It's like a constant high-stakes balancing act. Intervention, education, procedures.
Exactly. That's the bedrock of the whole specialty.
Okay, moving on. Medicine, especially a field like nephrology, is constantly changing. New research, new tech.
It moves fast.
So staying current isn't just nice to have, it's essential, right? Which brings us to question number 2. How do you stay current with the latest developments in nephrology?
Yeah, this question checks for that commitment to lifelong learning. Patient safety, getting the best outcomes, it really hinges on the nurse being up to date.
So how do they demonstrate that? What does the Kaplan Guide suggest?
It lists several key things. Regularly attending conferences and continuing education courses, that's structured learning, getting exposed to new findings.
Okay.
Then there's reading relevant journals for, self-directed study, and importantly, participating in case discussions with my colleagues.
Ah, that collaborative part again. That sounds really important. Learning from each other, not just books. How does that play out?
It's vital. These discussions let nurses break down tough cases together, share what works, figure out how to apply new research and practice. It's dynamic. It sharpens everyone's judgment.
Makes sense.
And the source also mentions being a member of professional organizations, like the National Nephrology Nurses Association.
Why is that significant?
It shows you're engaged with the wider community, you have access to networks, resources, best practices. It's about being plugged in.
So really, staying current isn't just about collecting facts. It's about constantly refining how they approach patient care.
Exactly. It's like they're always beta testing new strategies, adapting to new knowledge. It means anticipating patient needs, not just reacting.
It really underlines that continuous improvement is the lifeline for giving the best care possible.
Couldn't agree more.
Okay, speaking of challenges, I imagine a nurse's real skill often shines brightest when things get tough. It's easy when it's routine, right?
Definitely.
So how do nephrology nurses handle those really extreme challenges? Question 3 gets right into that. Can you describe a particularly challenging patient case you have worked on and how you managed it?
Right, this question is pure gold for seeing problem-solving skills and, crucially, teamwork under pressure. It's not just telling a story, it's showing how you think and act.
What kind of challenging scenario does the guide mention?
It gives an example of a patient with end-stage renal disease who had multiple coexisting medical conditions and was on multiple medications.
Wow. Okay, so end-stage kidney failure plus other health problems plus a whole bunch of drugs. That sounds like a minefield.
It absolutely is. Huge complexity.
Right.
The specific difficulties mentioned were it being challenging to manage their fluid and electrolyte balance, already tough in nephrology, and then having to constantly monitor for potential drug interactions.
The risk of something going wrong seems incredibly high there.
Very high. But the key in the example answer was how they collaborated closely with the interdisciplinary team, including the nephrologist and pharmacist, to develop a comprehensive plan of care.
Teamwork again. So It wasn't just the nurse figuring it out alone.
No, and that's critical. In complex cases, it's rarely a solo effort. You need that collaboration. The nephrologist, the pharmacist, other specialists, everyone brings their expertise.
Right, so teamwork isn't just a buzzword. It's literally a life-saving strategy, and once they had the plan...
The answer also highlights that they closely monitored their progress to make any necessary adjustments. It shows that responsive, iterative approach. You make a plan, you watch carefully, you tweak it as needed, you have to be agile.
So for you listening to this, it's not just a war story. It's really a case study in high-stakes, complex problem solving.
Exactly.
It shows you need that big picture view of the patient, smooth teamwork, and the mental flexibility to adapt on the fly. Like being a detective and a strategist rolled into one.
Under pressure, yeah. And that ability to integrate everything and adapt is what makes an exceptional nurse stand out.
Okay, let's shift gears slightly. Beyond the medical complexities, nurses deal with people, often people who are scared, frustrated, in pain.
The human element.
So how do they handle those difficult interactions? Question 4 tackles this directly. How do you handle difficult patient interactions?
Yeah, this really probes those crucial communication and empathy skills. A good answer, according to the guide, focuses on professionalism and listening.
What kind of strategies does it suggest?
Things like remaining calm and professional, absolutely key for de-escalation. Also, actively listening to the patient's concerns and addressing them in a non-judgmental manner. That builds trust.
Active listening. Just really hearing them out, not just waiting to talk.
Precisely. And providing clear, accurate information to the patient and their family and involve them in decision-making about their care.
That seems so important, involving them, especially when people feel vulnerable.
It's incredibly empowering. It respects their autonomy, makes them feel like a partner. That can make a huge difference in how they cope and follow through with care.
Any other points?
Yes. Also mentioning seeking guidance from my supervisor or colleagues if necessary. That shows self-awareness, knowing you don't have all the answers, and it's okay to ask for help. It's about the team again.
So what we're seeing here is that those so-called soft skills, empathy, clear communication, staying calm under pressure, they're just as vital as the clinical expertise.
Absolutely critical. They're essential for building trust and ensuring genuinely patient-centered care.
Okay, let's talk logistics. Getting things done. Nephrology nurses have demanding workloads, right? Multiple patients, critical tasks.
It's intense.
So question 5 looks at their organizational skills. How do you prioritize and manage your tasks and responsibilities as a nephrology nurse?
Yeah, this gets into workflow management. It's about efficiency and organization, which are crucial for delivering safe, consistent care when things are hectic. It's about running your shift effectively.
How do they show that?
The guide mentions using time management strategies such as creating a daily schedule and prioritizing tasks based on urgency and importance. So being proactive, not just reactive.
Trying to structure the chaos, basically, which must be tough in a hospital setting.
It is, and technology plays a role. The answer includes making use of technology such as EHR's electronic health records and task management apps to stay organized and ensure that I do not miss any important deadlines.
So being tech-savvy is part of the job now.
Definitely. It's essential for efficiency and safety. And again, communication. Additionally, I communicate effectively with my colleagues and seek help when needed. Knowing when to delegate or ask for support is key.
So for you, the listener, this shows that even in these super specialized roles, basic good management skills, planning, using tools effectively, communicating with the team are absolutely fundamental.
You got it. It's about making the complex manageable shift after shift.
Okay, finally, let's dive into a core technical area. The treatments that keep patients alive when their kidneys fail. Question 6 asks, can you explain your experience with the different modalities of dialysis?
Right, this is about that deep, specialized technical know-how. Dialysis is central to nephrology, so you need to demonstrate a solid understanding of these kidney replacement therapies.
What specific types does the guide mention?
It covers the main ones: hemodialysis, peritoneal dialysis, and home dialysis. That's the spectrum of common options.
And it's not just listing them, I assume? What depth of knowledge are they looking for?
No, much deeper. It's about having a comprehensive understanding of each. That means being familiar with the indications, contraindications, and potential complications of each modality.
So knowing when to use each type, why, and what could go wrong.
Exactly. Like, why might peritoneal dialysis suit one patient's lifestyle better than hemodialysis? What are the risks associated with each? It's applied knowledge.
Makes sense.
And critically, being able to assist with patient education and support for each modality. Again, that communication piece. Teaching patients and families how to live with these complex treatments.
So they're not just technicians running machines, they're educators and supporters too.
Absolutely. And it goes further, mentioning experience with dialysis-related procedures, such as the placement and care of central venous catheters.
Those are the access lines for treatment.
Yes, the lifelines. They need meticulous care to prevent infection and other serious problems. So this shows mastery of both high-tech procedures and that high-touch preventative care.
So this really reveals the intricate technical skills needed. These nurses aren't just caregivers, they're highly skilled technicians working with complex life-sustaining equipment.
They really are. They're experts in managing the technology that keeps these patients going.
Okay, so we've unpacked these 6 key areas. If we pull it all together, what's the big picture? What really defines an exceptional nephrology nurse?
Well, connecting all these dots, you see these questions paint a picture of someone who is, yes, clinically skilled and technically proficient, but also a compassionate educator, a super organized person, a sharp problem solver, and a really vital part of the healthcare team. It's that blend of deep, specialized knowledge with really strong interpersonal and organizational skills. That's the key.
It sounds incredibly demanding, but also rewarding.
It truly is. It's a unique combination of skills.
So for you listening, this deep dive, hopefully, gives you more than just interview pointers. It's a real look at the layers of expertise needed in modern healthcare.
Yeah, it highlights how crucial these specialized roles are for comprehensive, often life-saving patient care. You really appreciate the depth behind that title, nephrology nurse.
It certainly makes you think about the dedication and skill involved, often working quietly behind the scenes to manage these incredibly complex situations.
Day in and day out.
So today, we've taken that deep dive into what makes a nephrology nurse tick. We looked at their expertise in chronic kidney disease, the need for constant learning, how they tackle tough problems, handle difficult interactions, manage their demanding workload, and master those complex dialysis techniques. It all comes together to provide life-sustaining care.
And as we saw, each question peeled back another layer of skill and dedication. It does make you wonder, doesn't it? What other hidden depths of expertise are out there in highly specialized jobs, ones we rarely get a glimpse into?
That's a great point. How might understanding these specific interview questions, even from just this one field, change how you think about what it means to be a master of any craft, really, medical or otherwise? How much crucial detail do we miss in our everyday view of specialized work?
Food for thought.
Definitely. Keep exploring, keep asking questions, and keep diving deep into the knowledge that's all around